All right, everyone, we are live. We have Dr. John Hinman here with us today and his partner, John Sormark. Both of them are based in Alaska. Actually, one of our first StemWave providers in Alaska, our only one as of right now. And they're going to be speaking a little bit more about how they've essentially integrated StemWave within their medical practice, which is super unique just because um, Dr. Hinman is going to provide a very unique perspective on how he's integrated this tech within specifically the type of care that he does offer. So I'm going to stop talking now and I'm going to have Dr. Hinman essentially just take the mic. So if you could please introduce yourself, provide some background about your medical practice, and then as well, John, if you can also provide some background about yourself, quick introduction, and yeah, let's learn a little bit more about what you guys do.
Well, thank you. Thank you, Michelle. Hi, I'm John Hinman, and I'm a physician anesthesiologist, even before that, a veterinarian. And so I've had training in advanced pain management. Did that at Stanford, and then took that practice up here to Alaska. And my had a very successful practice in a classic type of pain management practice, but I was always very concerned about root cause. And so root cause is trying to get people to heal thyself. And so I've evolved into a regenerative medicine integrative practice, of which what we have at Phoenix Integrative. Was able to buy a StemWave product after talking to their CEO, excuse me, the CEO, Tom, and he was just instrumental in convincing me that this new piece of medical equipment was going to be a real boom to the practice. And super excited about it because it took a little encouragement, because when you have business partners like your wife and she says, "Oh, not another piece of equipment." And she said, she finally said, "Well, I'm sure you'll do the right thing." And I said, "Okay." And then then it arrives at the doorstep a week later. And she goes, "Oh my gosh." And so, however, it has been very excellent at dovetailing the regenerative medicine component in our practice that helps jumpstart people's belief that we can do something for them by reducing the inflammation and helping stimulating healing, whether or not it's preoperatively, postoperatively, or just avoiding surgery altogether. So we've seen it on a wide variety of things like shoulders, backs, low backs, knees. I even have a patient that, while dealing with her back and doing some reflexology by using the stem wave, not just on her back, but on her feet to help with this healing process, she can start feeling her feet again. And her inability before that to stand straight and not fall and tip. I mean, her son even bought her a couple of walking sticks for the house. Well, she's been able to put those aside because she can feel them and her balance is super improved. So we have all kinds of huge success stories like that. And in terms of my practice, it dovetails very nicely as a standalone as well as a component for the regenerative medicine, which I provide peptides, stem cells, exosomes, and very specific injections to help stimulate healing, like the prolotherapy type. So it's a huge component of that. So very pleased.
That's awesome. Yeah. Before I want to really talk a little bit more about how you paired this within regenerative medicine and like with some of the other things that you were mentioning about peptides as well. But before that, I'm going to have John as well. If you could provide a brief introduction and a little bit about your background and how you guys like met as well. How you guys have like developed this really unique working relationship. And I know a lot of providers as well wonder how you guys met and like how you guys got this started essentially.
Yeah, so a little bit about my background. I have a biomedical engineering degree. I've actually been in the Bay Area majority of my working career, and am now up in Alaska as well with Phoenix Integrative Medicine. I came in contact with John. We've always considered each other family, but I have consulted for his businesses in the past. And it just came about this past year that I had the opportunity to rejoin his effort. So in going up to Alaska and seeing what he's built there with his practice, just blown out of the water. StemWave has been a core kind of service of his practice and regenerative medicine. As he mentioned, it's, goes hand in hand with what he's trying to accomplish there, non-invasive, minimum, and to achieve regenerative integrative medicine techniques. For myself, I've actually been a patient as well. I've suffered from some shoulder pain from tennis. I was a D1 tennis player in my younger days, and I was amazed by it, really. But I think StemWave in general, it's innovative, it's on the cutting edge as far as technology, and as Dr. Hinman has brought that to Alaska, it's going to be a game changer for the state and for that local community.
That is awesome. I love hearing, it's so unique. You've tried it yourself, so you've had that firsthand exposure. You know what it's like to be a StemWave patient, right? And I think that's a huge asset, specifically when you start to market this as well to broader audiences and, existing patients and like even patients who are not familiar with the term shockwave, let alone StemWave, that want to learn more and are curious. So I think that's a huge asset for you guys, and it's definitely something evidently, and we'll talk about this as well, that's been very much favorable for your practice. I actually want to learn a little bit more about what was kind of like that aha moment for you, Dr. Hinman. Like you've been going back and forth with Tom as well. I remember those conversations happening. What was kind of like that moment that prompted you to integrate StemWave within your medical practice? Because I'm sure you're probably looking at other things as well.
True.
Yeah.
Certainly. Yeah, that's a good question. I was looking at competitor, and the price point was more favorable. And what I liked also about this product is the warranty, as well as the money back guarantee if wasn't satisfied. And then even more than that was the school option. So I was able to step in and listen to Dr. Barton, Dr. T, the Cesaro, and listen to what they were offering and the Zoom calls, educational experiences, so that I felt very comfortable with the platform being real and that people were getting honest, real life benefits. And so that helped me take that plunge. So when you see that kind of foundational work, you know that there is a whole cadre of people out there to reach out to as experts to help guide you with a new technology. And the school I went through, like most of that school opportunity, it was a little bit unusual because I hadn't purchased a device, but you were very kind in letting me in on that. And that's basically what it was, because I knew it was for real.
Awesome. Yeah. And that's the thing, right? Sometimes even more than like the product itself, it's the support, the resources, and that's something that integrating a modality, it's a bit of a learning curve, right? But when you have a pathway in place to get to those goals, like because we've done it over and over again with other providers, I could
Mm-hmm.
see why it provides you as someone, deciding should I go along with this purchase, that reassurance. So thanks for sharing that. Now you did mention again, I actually really want to know, like from your perspective as a medical doctor, which specific medical conditions or symptoms have you specifically found StemWave particularly effective for just over the last few months since using this?
Oh, it was a wide variety. So I'm always getting surprised, like the gal with her feet that were numb, and she's starting to feel sensation where she's actually ticklish at the soles of her feet, where the toes and such are still a little bit on the numb side because it's been an ongoing condition for 20 years. But it is very impressive. I guess the first patient right out of the box was a low back patient, and I'd taken care of him in my traditional pain practice before, so he had some confidence in me. And when we did that, he was able to put his walking stick down and walk without it, and he just couldn't believe it. He just said, "What is this?" And he's a really bright guy. He's a mathematician and he's got all these accolades. And it's like, I can't believe it. I feel so much better so fast. And so he's been coming in on a weekly basis and now on more of a monthly maintenance basis. So that was really encouraging, and just to have people just trust you, but then once they're treated, they say, what's this again? Because I really feel better. And so they really get their attention. And then it didn't take many treatments. It was like, how many times do you do a treatment and it's like wins right off the bat? So I would say we're batting like 90%. And the shoulders, just to get increased range of motion. I have a Afghan vet, one of our U.S. Army guys, that he couldn't even like rub his hair or comb his hair because it was so frozen from getting a bullet wound back in his shoulder in the day. And just one application, he was like 20% better. And then another, he's now like 70% overall better from this frozen shoulder. So he was like almost in tears. He was just so amazed. So we have a lot of stories like that.
Wow.
It just keeps growing. Yeah.
Yeah. No, that's so amazing. Just because I know there's a lot of people who they think that the alternative is going to be surgeries, and sometimes, and this is very common across the United States, that level of care is not affordable, or not feasible,
Mm-hmm.
right? Because of certain bandwidth. So I think that's remarkable that not only are you providing that clinical relief, but you're also providing people with those to gain back those opportunities, if that makes sense. So that's pretty
Mm-hmm. Absolutely.
Now, with that being said, you mentioned a lot of people don't know what this is, and they ask you, "What did you treat me with?" How do you
Right.
communicate, the option of StemWave treatment as like a part of their overall care plan? Like, what does that intake process look like, and how do you essentially introduce this to your patient?
Right. Oh, that's a good question. So we advertise a introductory rate of $49, and basically that is like most everybody can muster up $49, and so it really provides that aha moment. It's like, holy mackerel, I feel better. Or even if there was any kind of fear associated with it, like, oh, is this going to hurt? You use electricity? Is it going to shock me? And even as much as you can say, oh no, it works by pressure waves, a low intensity pressure wave. It's not until they actually experience it that they really can kind of wrap their head around that better. And so once we do and get that introductory, we're home to, we're onward. And that's when we sign folks on either for a program or just, each session with the recommendations of doing this twice a week for best outcome for at least 5 to 7 sessions, and then maybe 10 if it's more chronic. I've had some acute patients that actually just after 2 or 3 sessions, they strained their back and they didn't have a long history of any back problems, but it was really spasmed down. Then they were good to go. I even took care of a gal who was a soccer player, 17-year-old, and she had torn her glute muscle and had surgery to repair that. And it was still a problem for her. She couldn't move as well. And so just treating the glute area as well as her hip joint, she felt so much better in 3 sessions that she was pleased. And that's all we did.
Yeah, I think
Yeah.
that's so huge because, as much as you can tell the patient that, and the care plan is essential, them going through the entire, 6 to 8 sessions, or however number of sessions you recommend,
Mm-hmm.
um, a lot of the confidence and a lot of the belief is instilled within that first impression, and getting that biofeedback within those first 2 sessions. I think that is something that you don't really see very often within clinical practice, right? With a
Right.
lot of the care options that are available. So I think that that's huge that you mentioned that. I want to ask you though, John. I know you've been a patient as well of Dr. Hinman's, and now you guys have this really cool working relationship happening. Can you, if you don't mind, can you explain a little bit more about, some of the issues you had prior to getting treated by StemWave, and like essentially like how things are now, and like what that entire process looked like working with Dr. Hinman on getting treated?
Yeah. Well, I mean, how I was started or introduced to it was, my role within the practice is on the marketing side, product marketing as well, and product. And, in doing that role, I interviewed a lot of patients. And a lot of those patients were patients of StemWave. And, hearing their stories, whether it be, fractured vertebra and recovering from that, and almost in tears actually when they're explaining as to how they got back to their normal life that they had before, they're gardening again, things like that. It was just I was a little bit floored myself and thinking to myself, in the back of my mind, like, well, I do have this kind of tennis injury that every time I play 2 hours, my arm goes numb from the shoulder down to my fingertips, and I have this kind of just a discomfort for one day, 2 days after I play, and so I spoke to Dr. Hinman about it, and he said, "Oh yeah, this is the perfect application for that." So we did a quick 15-minute session there, and I was blown away. I did one session. I went back. I played tennis probably a week later, and I played for 3 hours. Didn't have any numbness or any pain in my shoulder, and I was just floored as to, wait, one session and this is what it felt like. And I think the day after the treatment, it did feel a little sore, as if I worked out myself. So I could feel that the treatment did something to my shoulder, and I'd say, like, after 2-3 days, that feeling of soreness of a good workout kind of went away. But I did follow up, did some additional treatments actually on the other shoulder. So I treated both shoulders, and yeah, like I said, I've been playing tennis now again for the last 2-3 months without any issues, without that numbness, without that discomfort and kind of pain in both of my arms, and it's, yeah, testament to StemWave and to the product itself.
Awesome. Now I'm really curious to hear from you, Dr. Hinman. Like, have you found any unexpected positive outcomes, or advantages with using this outside of treating the extremities? Because I know you are a medical doctor, and so curiosity is the creature for everyone. Yeah, chiropractors, but I know specifically with MDs that's the case. Have you
Yeah,
found any benefits using this on outside of like orthopedic use and for other areas?
I have. This may be a little off label or so already, even though I've only had the machine since April of 23. But I've had a couple of people that were struggling as far as like pre-pneumonia type symptoms and coughing, having some problems. And, the old fashioned system of like putting a little compression with your hands and tapping on people's chests to help open up their airways. I use that on a low level with the stem wave. And they both remarked, it was a husband and wife team, that their breathing improved radically, like right there on the table. And so they're impressed with that. And so that was a little bit off label. Certainly a lot of spine work up and down the thoracic spine and the lower back, as well as even the hands. When I've taken care of this little 93-year-old lady, she's just the sweetest thing and so pleasant and really smart cognitively. And so she had her lower back improved to such a degree after 2 sessions. She wanted to work on something else, and that was her hands. And so her hands are so arthritic. So by just doing a very soft stem wave treatment on both hands, she's able to open and close them better. And so that was a big deal for her.
Wow, that's awesome.
There you
Uh,
go. Yeah.
yeah, no, I think that's great. Have you you mentioned peptides, you mentioned the P shot as well. How have you, are there any unique cases where you've layered those therapies with this modality specifically? Any specific or unique patient cases that come to
Mm,
mind as well?
right. Yeah. As far as especially the P shot, which is trademarked by Dr. Runnels out of Alabama. And so that's where um, uh, erectile dysfunction can be treated with a multidisciplinary technique where you can use peptides to help with that engorgement, as well as specific either PRP, platelet rich plasma, or exosomal products into the body of the penis in this case, and then follow up with a treatment. It used to be very popular with something called Gainswave, but this technique, so it's already been kind of codified, but I think this machine, because it's less, um, it's not painful. You have the nice control of the settings. And so because of that and the biofeedback, we go between 0, I don't feel anything, to 10, like, holy mackerel, that's too much intensity. So running it around a 3 to 4 or so, and that would be in the treated areas, in this case, like in the penis. And so that would help improve the encouragement of growth and the your body's own types of healing factors to improve that area and treat Peyronie's disease too.
Great.
So yeah, that has been very. I really liked how it's. I had an earlier version when I trained with that Gainswave technique, and it was a radial device, and it was a more brutal. And so when I applied it to different parts on my body and such, that you just see how it felt. It's like, oh, this is kind of rough. And so the StemWave is not like that. It works through an ultrasound gel, and the interface is very gentle. And so in the Netherlands and such, that it's treated more effectively.
Huge. I have a question for you, John, and I want to dive a little bit deeper now into your background behind the scenes per se. So what you guys do essentially all the way there in Alaska with the marketing. What are some ways that you guys have promoted or marketed StemWave within your state? Knowing that you guys are the only provider there, talk to me a little bit more about what some of those processes look like, some of the channels you guys have used, and I guess like what's worked and what's not worked for you guys, just to be candid.
Yeah. Well, it's definitely a different environment than the Bay Area. Silicon Valley is a beast of its own. When you're going to Alaska, which is remote, everything is spread out. It was kind of a different approach. We started our marketing analysis and identification of what our strategy was by talking to the patients, right? First understanding their kind of customer journey, what their habits were, whether it be social media, radio, print, to try and identify what channels our existing patients were using. So in doing so, we kicked off our marketing. We wanted to do kind of a shotgun approach and look at all the channels, see what the ROI was coming to, but that's still ongoing. We started off by doing kind of radio advertisements, introducing Dr. Hinman, integrative medicine, and then ran or are now running kind of more specific StemWave ads on the radio. In addition, looking at also, or we're actively running social media campaigns as well, mainly targeted Facebook, Instagram, and then we have plans in the coming weeks to go after print media as well. We have a lot of kind of local publications that we're looking to go after. And then a lot of it's on the ground marketing, right? We've gone to gymnasiums, introduced ourselves, tried to promote or sync up with trainers, with coaches, provide them with the treatment. We found that the best marketing are the patients themselves. By undergoing the treatment, they can see the results themselves, and the word of mouth campaign in Alaska works very well. So we're focused on a lot of on the ground marketing, and just spreading the word, getting people in the door. What's worked for us well, it's always difficult to measure radio, but we still have patients come in, oh, I heard Dr. Hinman on the radio, he's got a great voice, and just ecstatic about that. But that's more, I guess, reinforced marketing when they've seen it elsewhere. Facebook, like I said, it's a different beast in Alaska, but we are, further optimizing our campaigns. We're driving traffic, have appointments coming on board more and more now so than we did in the beginning. And I think that's where optimization comes into play. When we start with our print media, I think we'll have some good results there as well. They have 30,000 plus circulations of kind of local papers in the community there in Wasilla. And we're just looking for how to connect with our patients and our patient population. And like I said, it's going to be interesting at the end of next month to kind of look at all these avenues that we've taken in our marketing approach and seeing what has worked best. And but yeah, so far everything is going well.
It may be hard to quantify this, like you did mention. I know you guys are doing the radio ads. You have different channels set up, Facebook as well, and you guys are about to do print. Do you guys mind sharing, just in general, like what are some of the financial and revenue returns from some of these marketing efforts within your state and within your practice. I'm sure a lot of people would like to know what some of those metrics and what some of those numbers would look like. Yeah, if you guys could share, that would be great.
Yep, I think on the easiest way to look at the metrics, our radio campaigns, we are spending, about say about 1,000 a month there. Our coverage though is across Anchorage, the kind of valley there in Wasilla as well. On the social media side, it's a little easier to look at our ROI. I'd say in the beginning when we did not have our campaigns optimized, our click-through rate and click per action of actually signing up for a consultation was relatively high. I'd say much higher than we expected, and even StemWave as well, or the marketing team there. But we were looking almost at $60, $80. Right now, in the last week, we've gotten that down to like $20 to $30. I think we want to further optimize that and try to see if we can get under $20. And the patients, that have been coming in, are just that for, back, joint, shoulder. So it's focused on, I guess, in Alaska, you do have a lot of oil mining, a lot of kind of hard labor jobs, right? So it's about optimizing our campaigns to target those individuals or that demographic that we feel like StemWave would change their lives or improve that.
For sure. And Dr. Hinman, if you'd like to also add to that, I guess specifically, have you noticed an increase in retention, patient retention, or just in revenue in general for your practice as a result of offering StemWave as a treatment option?
Yeah, I think StemWave is a very easy, straightforward type of introduction to the practice too. So we've seen a definite increase because we offer a variety of services from IV infusions to ozone therapy and EBOO, which is this very fancy name for providing ozonization and clarifying the blood and treating with UV light too. And that's been a big winner for long COVID. And along with some of our long COVID sufferers, StemWave, I've introduced that as well, just to help reduce some of the muscle spasms that they have. And that's been a game changer. So it helps as a segue to our other services too. That's true.
That's huge. And what's interesting is you guys are in a very unique market. And while some might say, wow, Alaska, that's pretty far, it's remote. Is that a disadvantage? It doesn't seem like that's the case. If anything, there is the demand for this within your state, within where you guys are practicing amongst your patients, right? And for those individuals who are watching, who are maybe in California, maybe in some of the other metropolitans like New York City, the East Coast, right? More populous areas. And if you're doubting, is this going to work for me? I mean, it's working for Dr. Hinman and John over there in Alaska, right? You guys are getting some phenomenal clinical results from what it sounds like, but also from like a business integration standpoint, combined with your marketing efforts, you guys are seeing success, right? And that's really just, I wanted to say that just for anyone who is thinking, should I go ahead and do this? Is this going to work within my market? I mean, you're hearing it yourself. It's working in a market that's pretty remote, right? Because there is a lot of demand for this alternative form of care.
True. That's very true. And we can hardly wait till you get the portable model. So when we go fishing down in the Kenai, we can bring our machine with us and treat along the way.
I can already see, like, John is smiling. He's probably thinking of like a marketing like picture to take for that. Something to
Oh yeah, we're going to bring it out to the mining sites and the oil fields and
That's right.
Sort of lunch appointments as we're out there with the StemWave machine. So we're looking forward to integrating that in our marketing plan once it's available.
For sure. Absolutely. I love that. Yeah. I kind of want to ask you now, Dr. Hinman, just as an MD and, with the plethora of success and expertise that you have, how do you envision shockwave therapy and even like just even our device, StemWave, evolving in your field of medicine in the next upcoming years?
Well, as physicians start to realize more and more and I say physicians because a lot of the other practitioners have had that figured out, chiropractors especially, I think, that you're encouraging the body to heal, and there's all kinds of mechanisms that we utilize. We've been a little bit on the brainwash side to just utilize medication type therapies, and we're starting to see, I think, especially with the latest climate of long COVID and such, and the assault we've had on the country, that some of these getting back to basic tools and helping the body heal itself and encouraging and reducing inflammation, that is more sustainable than a lot of medications, and that helps promote as a segue for people to have a better diet, start to exercise more because they're feeling better. So I think it segues nicely into patients taking responsibility for their health. And even though this isn't paid by insurance, that can be a blessing too, because now they're investing themselves more directly instead of just letting somebody, give them something to make up for perhaps they're not involving themselves in their own health as much as they should have. So I think it's again, it's a blessing. And in terms of the larger audience, I think more and more physicians, MDs and DOs and such are seeing the benefit of that kind of philosophical change, and that maybe there's something else to add to the regimen of care to help our patients.
For sure. Um,
Yeah.
yeah, John, did you also have any input on that? What's kind of like your perspective on how this can be integrated within the medical practice, specifically outside of traditional chiropractic care?
I mean, like Dr. Hinman mentioned, we see crossover from all of our services in with StemWave. So it's and vice versa. It's great, within integrative medicine, naturally healing your body or using the kind of natural mechanisms within the body. StemWave falls right into that, right? It's stimulating, promoting kind of cell regenerations towards in targeted areas that they're treating. So it's hand in hand in my mind, and as we continue to grow the practice, we are looking and we have the room to expand, get additional STEM wave units as our patient population grows.
That's awesome. With that being said, let's talk about future plans. I know it's been a few months, right? But 2024 is right around the corner. We only have a few more months left till 2023 ends. What are your guys' like upcoming goals with this device within your practice, for like the next upcoming year?
Well, as we grow and get busier and busier, then this initial 6 months has been me exclusively doing the STEM wave treatments, and so I can get a really good handle on those protocols, and then just start having some of our ancillary personnel start to handle that and just come back and forth to me on these tougher cases and see how things are going. We've started exploring that, and it's with that kind of guidance of somebody who has had the official training and has been through the program and watched all the school videos and stays on Zoom calls so I can see what's happening nationally. That's all promoted by your company, which is super awesome. It's like it's unique in a way, and so love that. We get a lot of good kudos on how to do a better job and expand our own horizons and thought processes. But to answer that question again is just hire more staff, and so we can start taking over some of that load from me and have other people do it
Mhm.
for me.
Yeah, it's a good. I don't want to say problem, but it's a bottleneck that almost any practice experiences at some point, where you're a great clinician, you're a great MD, but you can only do so much, and there does come a time when I think it's a message to everyone who is a solo practitioner who isn't really thinking a lot on the business side of things, that you have to sometimes start thinking about the scalability and building out those systems within your practice so
Right.
that you can hit some of those goals and that you're not bottlenecked, right? And I think I see it a lot working with different offices as well. And you yourself saying it, Dr. Hinman, I think that's huge coming from, another MD, another practitioner, right, who is at that point and who recognizes that that is a necessity. Scaling this out, hiring more staff, working on developing a system to where you could really focus on the education with your patients and not have to wear all the caps, trying to perform all the treatments. So it's a great point.
Yeah, it's a nice problem to have.
I, I don't like saying problem, but I want to say it's a good thing, right? You want to get
Yes.
to that point where what's next, right? After you hit seven figures, multi seven figures, right, with your practice, right? I think that's the goal for a lot of practitioners who are watching this as well. So with that being said, and I just want to wrap a button to everything that we're talking about. If you can give a piece of advice to another MD who is considering the integration of StemWave within their practice, but they're on the fence, what would you encourage them? What would you say to them?
Oh, let's start attending the Zoom calls, go to school, and get some education as to what we're talking about, and just see how that can become a reality so quickly.
Awesome.
Yeah.
Yeah,
I
go
would,
ahead.
I would say, myself having joined those calls as well, hearing all the use cases, all the experiences from patients across the US, definitely validates the product, validates the procedure and services that you can offer. Like I said, it's very complementary. It's within integrative medicine in any practice. I think it's definitely a great service to have.
Awesome. I think a lot of people watching this is going to give them that confidence as well, right? Because sometimes I think a lot of medical device companies, we've seen this, that the product is there, you get some of that technical support, but you don't really know what that pathway is going to look like for success, right? And I think it's so huge that you guys have taken advantage of all the resources here, and that's super important to ensure that you guys are successful with integrating this, not just from like a clinical standpoint, but also within your business setting as well. So yeah, thank you guys so much for doing this, taking some time out of your really busy schedules. I know you're probably dealing with a lot of patient appointments today as well, Dr. Hinman. So I really do appreciate you taking the time out to speak with me today and to share
Thank
some of
you.
your experience. Same with you as well. Same with you as well, John. I almost called you a doctor, but you're just so knowledgeable about everything here that we're doing and just with StemWave. So thank you guys so much. And for anyone who is looking to book an appointment, learn more about what Dr. Hinman is doing, I will link down his website and clinic name as well, Phoenix Integrative Medicine below. And then you'll be able to get in contact with him. And if they'd like to book an appointment, what would you recommend, Dr. Hinman?
Yes, give us a call at 907-631-0794.
Perfect. Awesome. And
Yeah.
I want to listen to those radio ads too. So
Oh
that's
yeah, I'll send those over. And a big thank you from our side as well. I think StemWave, the whole StemWave team, is a partner in this, and the resources that you provide, the kind of marketing team, the assistants, it's been great, right? It's been fantastic to have calls that we can jump on 3 times a week to share ideas, to ask questions. So I would, definitely give a gold medal to the team as well for support.
Absolutely.
Thank you guys so much. I'm definitely going to relay that to everyone internally. They're all working behind the scenes. We have a full team here at StemWave, marketing team, an entire client success team built out, a product development team with key engineers. There's so much happening behind the scenes, right? Sometimes you guys don't get that visibility either, but I just thought I'd share that with everyone who's watching and you guys, that there's a lot that goes into the background. So
Yeah.
but we're all here to help, and we're all here to support you on your journey as you provide an alternative form of care that can be more accessible and affordable to a lot of Americans. So that's awesome.
Thank you.
Thank you guys so much.
Thank you.
Awesome.
Take care.